All right, well, welcome to our final session of a great 2 days. I think over the last 2 days, we've heard several experts graciously share their knowledge about many things, and hopefully you've been able to take some pearls away. I would offer my own personal bias that the parents who have graciously agreed to share their own personal stories this afternoon are experts that we all can learn a great deal from. So I would invite you to open up and listen to their stories and think about how that can affect your everyday practice. As a nurse practitioner, a clinician first by heart, I would always tell new folks that I was orienting that what you do today, you may not remember tomorrow, but the families you impact will remember those details for the rest of their lives. So I encourage you to think about that in your everyday practice. So I'll start. Lynette Hicks, who is right here in front of me. Lynette, raise your hand so we'll know who you are. Lynette's son Colby was in a pretty significant go-kart crash 10 years ago. He is now 21. He spent some time in our pediatric ICU and then went on later to Levine for rehab. She is here with her father today, who is to her right, who was the first responder to Colby. He was the first person to be on the scene when Colby's accident occurred. So we will be grateful to hear her story. I think Dr. Pranikoff, you were the physician and surgeon for Colby at that point.
So we're going to begin with having Lynette share her story, and I think we have some pictures of Colby, maybe that we can show you on the screen. And Lynette, you may turn back and be able to talk through some of those. Get your microphone.
These are all three of my children. Colby, of course, is that your left? Colby's 21. This was taken at White Lake. This is our annual trip. You'll hear me talk in just a minute. This is kind of the precursor of the accident. My youngest son, Avery, is now 8. He's in the middle, and my daughter, Ashlyn, she's 11. This is Colby. This is the first picture when he went back into 5th grade. This is the first picture taken after his accident. And that was just prior to his accident at the end of 4th grade.
So when Colby's accident occurred, you guys were actually at a family gathering, and it was Mother's Day. Why don't you take us back to that day and kind of set up this scene for us and tell us a little bit about what happened that day.
Okay. It was Mother's Day, May 12th, 2002. Colby was 10. He was finishing up the 4th grade. He was an honor roll student at the time. This wasn't a regular Mother's Day. For whatever reason, we had went to my aunt and uncle's house. I can't remember the reason why it was. We'd always went to my grandmother's house. This year it had been decided that we were going to my aunt and uncle's house. My aunt and uncle have a go-kart. Every year we go the week of the 4th to White Lake, and they have a go-kart track there. Colby had always wanted to ride the go-kart, but I'd always made him ride with an adult. Little overprotective mom here, but he wanted to learn to ride so he could ride by himself. Well, lunch was finishing up, and I went out the door of my aunt and uncle's house, and the next thing I know, just as I'm exiting the door, Colby comes flying by on a go-kart. I knew by the way that he was going too fast. I knew something was wrong. Just by the way that the go-kart was just going way too fast. When I looked up, my uncle was running after him. I couldn't see what was happening because he went behind a shed. I took off running after him. In getting about halfway behind the shed, my what's now my ex-husband grabbed a hold of me and said, "You don't want to go. You don't want to see this." somehow I managed to sling him off of me and said, whatever it is, I've got to see. When I rounded the corner of the shed, Colby was laying unconscious in a garden, bleeding massively, with cuts to underneath his right eye, and he had cuts from ear to ear. He was quite a ways away from the go-kart. What had happened was he had run the go-kart up under guide wires that were strung to support grapevines. At this point, excuse me. My dad and uncle were with him. I thought he was going to bleed to death. There were massive amounts of blood everywhere. He quit breathing several times. I begged him to breathe. I begged God to help him and to let him breathe. At this point, I had no idea the true extent of his injuries. My dad, who at the time was and still is an assistant chief in the fire department, a first responder, he actually knew the extent of Colby's injuries. But by the grace of God, he was still able to help him. He broke every rule that he knew. At that point in time, first responders weren't supposed to call for air care. But he went against what he knew that he was supposed to do because he knew Colby would die without air care. Air care was called, and he came, he was transferred to Baptist. I couldn't leave immediately knowing that I had a very long drive ahead of me. I had to go, I had to see him be put into air care. I had to know that he was still breathing when air care took off. I think I realized it was quite a bit more serious when I walked through the emergency room doors, and somebody said, "Get somebody with her now." The doctors came in to tell us his all of his injuries, and that's the first time I heard brain injury. What are they talking about? Brain injury? That's what Dad had known all along. At this point, Dad wasn't handling things well. He had turned it over to others, and he kind of lost it at that point. It was okay, but he didn't think it was okay. He didn't think he had done enough. We were told he had brain injuries. He had severe lacerations to his face and his neck. He had a broken nose and a shattered right jaw. His C-spine wasn't cleared for several days, and we were told if he did make it, that the prognosis didn't look good for him. They didn't know if he would be productive. Thankfully, I had an aunt who was an ER nurse, and she kind of deciphered all of it for me. And the one thing that she helped me hold on to was she heard them say, plastic and reconstructive surgeon. And she said, Lynette, she said, they wouldn't have plastic and reconstructive surgeons working on him if they thought he was going to die. They'd just close him up. So I held on. That was my bit of hope, even though they were saying it doesn't look good. I held on to that for days on end. I stayed in the PICU for days and days and days. My aunt finally, on the third day, she made me come out and take a shower. I still had blood all over me. I couldn't leave. I was afraid if I walked away, he would die. After, I can't tell you what day it was, but he finally started coming out of a coma, and he became combative, which was hard to see for a child that had been so mild-mannered, a child that was so sweet. And you've got a child that was cursing. He flailed at nurses. He had one that, it's funny to say now, but at the time it wasn't. He grabbed a hold of her, and he grabbed a hold of her belly button ring. This was just not this child. He was eventually moved across the hall from PICU to intermediate care, and then he was actually one of the very first patients in one of the new Brenner's rooms. I think it was actually the cardiac unit that he was put in because that was the closest thing to PICU. And they wanted him to be really close because of the types of his injuries. When things got to where Colby could, he was able to not necessarily be up and about, but he was out of the coma and everything. Colby had a passion for drawing, like no other child you'd ever seen at the age of 10. And we tried to get him to draw. He wouldn't pick up a pencil. You're talking about devastating. We kept on him and on him and on him, and finally, my dad had drawn a picture, and my dad drew all the time when he was younger, but I hadn't seen my dad draw anything in a really long time. And one day I'd been out, and I come back in, and he had drawn a picture of the two of them fishing. Dad went out for a while, and I gave Colby a piece of paper and a pencil, and I said, please, just draw just anything for me. He drew a circle. You guys can't imagine how important that circle was. A simple circle. That was the day it was going to be okay. Later, we learned in therapy that he wouldn't draw because he was afraid he couldn't draw. Something that had been so important to this child. He was afraid he had lost his ability for his passion.
Where's that circle now?
Colby has that circle. That circle is important to him still today. He has that picture that my dad drew with the two of them fishing as well. He was transferred to Charlotte Rehab for therapy. He became very depressed at Charlotte Rehab, having to have a feeding tube. He was in a wheelchair. Not only that, seeing a lot of the patients that are in extreme conditions at Charlotte was very depressing. It was very depressing for me, being away from family, being away from friends. But he had to go through therapy to regain strength in his legs, retrain his brain how to walk. He had to learn how to reprocess, how to read. He could look at "the" on a piece of paper, but until he said "THE," he didn't know that it was the word "the." His short-term memory was affected. Over the summer, he continued outpatient therapy at Davie County Hospital. He went back into 5th grade with various interventions in place. One of those was that during PE, he would get tutoring instead of attending PE. It was very important that his jaw not be re-injured. He had an absorbable plate put into his jaw. In the 6th grade, It was a big jump. He went back into, he went to middle school. And he also went back into PE. This was devastating to this child. The first day he walked into the gym, he passed out. EMS was called. They couldn't get him to come around. His pupils were fixed. Smelling salts didn't bring him out of all this. I work in downtown Winston. We live in Davie County. I won't tell you how fast I can drive to Davie County. And it became an everyday occurrence. We took him to doctor after doctor, specialist after specialist. Nobody could figure out what it was. Nobody could figure it out. They were perplexed. I had some doctors tell us this child's faking it. I had EMS that were telling him this child can't fake this. Finally, his family doctor figured out that he was dealing with conversion disorder. What would happen was when Colby would experience what he thought was a trauma, anything negative coming towards him, his way of dealing with that was to pass out and avoid what he felt was a threat to him. Basically, in essence, his subconscious mind was taken over. Once he was properly diagnosed, we got him counseling. And the counselor and his family doctor told us he would outgrow it. They promised us. He did. The method that was used is very simple. It seems so odd. I can see how doctors thought he was faking it. They taught him to do the alligator, something so simple. You would open his eyes while he was passed out. You do the alligator, let him see, let him feel. He's okay. It brought him around every time. He would come to, and he would be fine. It took about a year of counseling to get him there, but he was fine. And he doesn't have any problems to this day. The only issue that he's had, he had migraines, but as of about a year ago, he's not had any problems with migraines. He's alive, he's well, he works full-time, he goes to school full-time, he lives on his own. He's more productive today than most 21-year-olds that you'll see. He is truly a walking miracle.
Lynette, when Colby was injured, you had a new baby at home and another child, and or maybe just the new baby
Just
at the
new
time.
baby.
And you were kind of in the middle. You were having to play a lot of different roles. Tell me about that, about what that was like for you being in the hospital setting. So kind of take a step back.
My daughter was only 11 weeks old at the time. I was very torn between knowing what to do, where to focus my care. I had a son that I didn't know, if I took one footstep away, would die. But I had a newborn that I was supposed to be making those bonds with. I had a dad that, because of his feeling that he hadn't done enough at times, he didn't talk to anybody for weeks, and at times was almost in a catatonic state. I'm a daddy's girl. I did not know where to focus my attention. But I had to make that choice that Colby was what needed me most at that time. It was a very difficult decision to make. My grandmother actually retired I was very fortunate she retired to help take care of Ashlyn at the time. But it was still difficult because when they would bring her to the hospital to see me, when she would cry, my stress levels were so extreme, I couldn't deal with, I couldn't deal with crying. So it was extremely difficult.
If you can think back to things that we could have done as caregivers to make things easier for you, what a traumatic time for you to go through to watch your son, but are there things that you've thought about that we could have done to make it easier, to help you understand anything any better, to, I don't know, honestly, to help you cope with any of that?
Thinking about it this far out, if there's any way that counseling could have been provided along and throughout, the doctors were great providing the information along, and thankfully I had a nurse as an aunt that could interpret that information. And you know, family is great to be able to lean on for support, but sometimes you just don't want to go to family. Sometimes family is looking to you to be the one to stand up and be there for them. And there were times when I needed to break, and I didn't have that opportunity. So that's, if there was, that would, I think, would be the one thing that I think, and that may be something that happens now. This was, you know, a long time ago, but that's something that was missing, I think, when Colby was there.
During my time in the intensive care as a bedside nurse, we had requests from families all the time to keep items that were with the child while they were with us. And, you know, I can think back on my own time thinking, okay, really, do you really want that blanket? I mean, it has blood all over it. Or do you want that? And Lynette has brought some things that she's kept for all these years. She has the nasal trumpet that he had. You know, but that was...
Don't ask why. I don't know.
She held it up and said, "Tell me again what this is. Where was it?" You know, but that was important for her. And she has the wire cutters. His jaw was wired shut. And she's kept the wire cutters, and they're still in the bag. And it's important, symbolic of what his journey was.
They were taped to him everywhere he went for 6 weeks. It became a part of him. And there's times when you go through the boxes of stuff and you think, why am I keeping this? And then you think, I've kept it this long, there's a reason I'm keeping this.
Yeah. And even Colby's little shirt, the red shirt that you saw in the picture, that's over there on the table. You know, just important mementos for her. We've also talked a lot about milestones, and you know, when we talk about patient and family-centered care, we really emphasize that it's so much more than just the patient who's dealing with whatever the injury is or the illness. And Lynette and Papa have both, excuse me, met their own milestones. Lynette, what was yours? What's your milestone that you have?
For whatever reason, I didn't necessarily blame grapes. I didn't blame grapevines. My ex-husband came home and said he wanted to plant grapevines around our fence that went around our house. Of course, you can imagine I was not thrilled about that idea. It happened. I don't mess with the grapevines. But about 2 years ago is the first time that I ever ate a grape. since the accident. Those grapes didn't do anything to me. But it was an association I made. And eating a grape was a huge thing. I thought that it would be okay, and I thought I was over it after I ate a grape. I'll never be over it. The healing continues every day. Nothing can take the images out of my head. They'll always be there. There will always be certain sounds, certain triggers, certain things that are said. But eating a grape was a huge thing for me, as silly as it may sound. It was huge.
And so, Papa, I'm going to turn to you because you have crossed a milestone today. So tell me about that shirt that you have on.
This shirt was the shirt I had on when Kobe had his accident. Yes. Took home sometime later, of course, and washed. Hung up in the closet at the house. It has not been out of the closet until today. I just set my mind to it. I went in there. In fact, I already thought, I said, today will be a good day to get that shirt back out and wear it. So, after all these years, it still fits too.
Day of celebrations, isn't it?
Yes, absolutely.
Lynette, I would love for you to show some of Colby's artwork that he's done, and one of them has a particularly special story that goes along with that, but you'll just tell us a little bit about that. I want you all to see what a talented artist he is, and
This is very near and dear to my heart. This is the first thing that Colby actually drew as a drawing after his accident. This is the dream house that Colby wanted us to have. He called it Lynette House. Remember, he was in the 4th and 5th grade. This is, if any of you are from Davie County, we have what we call the Center Fair. It's actually put on by my dad's fire department and the community association. He won first prize in his age group for that. It hangs in my kitchen where I see it as I come in and go out every day. It's my prized possession. Colby had a fascination at the time of the accident with airplanes and boats. You can see why the circle's so important. He drew airplanes. He designed his own airplanes. He designed his own boats. And I don't have anything current. He doesn't like to let go of his drawings. He likes to keep all the papers, even his mess up drawings. We had issues with that, him growing up. But these are some of the things like what he draws today. This is actually from 2007, so he's got, another 6 years on this. So today he's into drawing prototypes for cars. That's his newest fascination.
Thank you so much for sharing that. The story is certainly so inspiring, and I'm so thankful for you all to be able to come and celebrate and be able to share some of that. I had the opportunity to care for Colby when he was in the ICU, and Erica, who's with us today, also cared for him. And so nothing warms your heart like reconnecting with the patient and family. So
I want to thank each of you all for allowing us to be here. Us being able to tell the story continues our healing process. As I said, it continues on. It doesn't stop. Even though I thought eating that grape was the final part of the healing process, it's not. emergency services and emergency medicine has played a huge role in my life with my dad. Being in the fire department since 1985. I've kind of grown up there, grown up all around it, seen, heard lots of things. Don't want to see and hear lots of things anymore. I can't deal with as much of it anymore, but just know that a lot of the things you do don't get the thank yous that you deserve. But the miracles that you perform, the small ones, the large ones, thank you from the bottom of my heart. I have my son because of people like you. Thank you.